Another edition of the CHCH Newsmakers podcast. I'm your host, Rick Zamperin. The Hamilton Public Library has launched a pilot project at its central branch downtown in response to growing safety concerns over drug activity in the branch. Joining us today is the chief librarian of the Hamilton Public Library, Paul Takala. Paul, thanks for joining us on the podcast.
Good morning.
This is a very interesting story. The pilot project obviously is a nugget that we're going to dive into. But before we get into that, what have you been seeing at the Hamilton Public Library Central Branch? What have your staff been dealing with?
So for the last few years in Hamilton, and I think like many other cities in Canada and in Ontario, we have 23 branches. Wherever there's a branch located to an area where there's a lot of drug activity, like there has been on York Boulevard, it ends up affecting what happens inside the library. And so what we've seen is, and we're calling it, really called a toxic drug crisis, in the sense that we've seen different versions of, different drug use over the years. What we're really seeing now is just a different level of activity that's really impacting the library. People distributing and using drugs inside the library. People, we're having to clean washrooms multiple times a day because we're not able to stop that activity from happening.
Right. Are you seeing this in other branches within the library system, or is the downtown central branch the one?
It is. We have periodic problems, and you'd have to say, Barton branch has had challenges because of where it's located, and staff do a great job there. But it is fairly localized, and when we look at, say, a couple times we've maybe had problems at Picton a few years ago, but those are not Picton, Parkdale, but there's. Most of the branches don't see anything like what we see at Central.
Right. Was there a breaking point or a moment where the library and the board said, listen, we have to do something different at the downtown facility?
Yeah, well, this year, what we've seen that we've never really seen before is open drug use. So if you're walking in the library, people will be pulling out their pipes and smoking like right by the entrance. We've seen people do this inside the library. We know it's happening in the washrooms because of the sensors, and we're trying to prevent that. But it's just this visible. It's really, you can't ignore what's happening, and so we've seen our children's department is often empty, and then when we do get people coming to Central, you can see they're just not comfortable because of what's happening around them. So we kind of reached a breaking point this winter. And we had, even back in December, we weren't talking about the need for potential closure. But by the time we're into last month, we were saying to the board, we really need to look at like what some other libraries have done, which is a temporary closure to kind of reset. And so we started talking about that, but then it became clear from talking to a lot of people in the library that use the library every day, they're saying, are you going to close? Please don't close. And so we try to work on an alternative method to keep the library open, but also, and so it's a temporary pilot, but just to give us tools in the future so that we can implement a protocol for a while if we need to stop the drug activity. And this is not the first year we've gone through this. We go back to like 2013, 2012, we were dealing with a much lower scale, but different drug supply and different problems. But what we've dealt with, increasingly since the winter of 23, 24, so the last 3 winters have been like on a scale of problems we've never seen. And I think the cold weather this winter probably exacerbated the situation. Right. So all these things came together, and it's like we're realizing, when are we going to be able to welcome families with children back in the library? We have a lot of seniors come in the library. We have a lot of newcomers, and we have newcomers coming to the library, and we're really helping support their integration and working with them. And it's really great to work with these people, but when they don't feel safe because of what's happening around, it becomes a difficult situation. And I think we kind of realized we've been advocating for more, say, provincial treatment. Ultimately, there's mental health, addictions, and also the homelessness problem, or, all those things, in a sense, are outscope of the library or the city of Hamilton. But so we need to continue to advocate for positive interventions from, all levels of government. But we also need to do what we can for the families here in Hamilton that want to be able to bring their kid to story time. And that should not be something that they have to stress about.
Yeah, certainly a disrupting element for visitors of the library. What about staff? How have they dealt with this situation? What kind of pain have they been in?
So I think, we've been through it for quite some time, and so there's certainly a cumulative effect for everyone. I think sometimes, people are afraid of certain situations. I would say the biggest feeling is just a general sadness of seeing people, in kind of such a bad state. So I don't think like it's not that people are coming into the library to actively disrupt or hurt people. Yeah. They're just kind of in a state where they don't really understand their behavior is so disruptive to everyone else.
Let's get into the pilot program. How is it going to work, or how is it working?
So we're on to day 3 now, and the last 2 days have been a big improvement from what we've experienced in the last 4 months, probably. So it really is an extension of a program we started back almost 15 years ago, where we used to have problems on the computers. And so we get a lot of people using the computers. You can log in with your library card. And then we also just gave out anyone that wanted a visitor pass could get it, and then they have anonymous access on the computer. What we found was a lot of people with library cards were getting visitor passes, and then were doing inappropriate things on the computers. So it's not that they don't have a library card, it's that they are not accountable for their actions. And so what we did was we limited anonymous access. If you're from out of town, just show us an ID and we'll give you a visitor pass. But if you're a resident, we have a program to get anyone a library card. You don't need government ID. And so, we're just asking, when you're on the computer, you're accountable. And if you violate, the rules for our public space, then, there'll be a suspension from your computer privileges. And so, so basically the problems went down like significantly, and, maybe 80-90%. We're not sure what the impact of this is going to be, but what we're doing is, so anyone can get a library card, but we're just asking people, hey, just identify when you're in, and you're accountable for your behavior, and you're welcome back. But if you do, say, consume drugs in the library, you should expect that there's going to be some consequences, like a suspension. Yeah. And it's as simple as that. So we've been signing up a lot of people for library cards, people that didn't know they could have a library card. And I think that access program, we call it Inspire Card, that's been around for, like I said, over a decade. Probably a lot of people still don't know about that. So we want everyone to be able to get a library card. And I think one thing about libraries is we try to see people. So if you're a newcomer, we're not asking what your status is. We're just trying to, and what we've seen last few years is, say, a lot of refugees are coming into the library. They're using the computers to apply for documentation, apply for programs, apply for jobs, doing whatever they need to do. And so they're focused on trying to move their lives forward. And, we're just there to provide some simple resources to help them make those connections. So it's just this level of drug activity that we've experienced at Central, I know has happened at other libraries. And what we've seen, and so this is not kind of theoretical, we've already seen a significant decline in usage of our Central Children's Department that goes back a couple of years. And so we need to reverse that. And so I think we're doing this pilot at the end of the winter so that we can work together advocating for solutions, so when we go into next winter, we're not going to be in the same position we've been in, certainly for the last 3, where we're waiting as soon as the weather gets cold for a spike in, really serious problems.
Yeah. There was some pushback from critics or those in the community who thought, oh, no, I need a library card just to access or gain entry into the library, the check-in protocol, I guess it was called. How does that work? Do you want to clarify that?
That's a great question. So if you walk into either Jackson Square or York Boulevard, we have what we call Main Street, which is it's a big hallway that you can walk through the building. That's accessible without the check-in point. Actually, we have some social workers in partnership with public health. Their offices are before the check-in, as are the main computer area. So people can come in and they can visit the social worker, they can get on the computer, but if they want to enter the main part of the building, that's where the check is. And the reason for that is so people can come through, they don't even have to pass through, or people can come in and stay in that area. What the problem is, there's been so much drug activity on that first floor washroom, which is currently adjacent to the children's department. And so, we can't let people, I'm sorry, smoke fentanyl or whatever the substances are, in the washrooms right by the kids area. And we've tried everything else. And so, it seems to be working so far, but the board it's a pilot for 2 months, and then we are going to need to evaluate, and we are going to be asking the community for feedback. And I know there's kind of a lot of emotions around this issue, and so we really need to make sure that we're hearing from the communities impacted, and we need to hear what they think and how it's benefiting or not them. So I think that's going to be happening over the next while, as we also work with partners, the city, others, to advocate the province for. So we're going to be inviting all the MPPs to the library for a conversation, and I think we need to focus on what solutions can be implemented. And we're certainly here to work with anyone that wants to help move Hamilton forward and move the conversation forward. And, I'm not sure how much influence specifically we have over provincial policy, but, we're happy to participate in that conversation and maybe articulate some of the challenges that we see like other cities in, certain areas.
Yeah. Have you reached out to other libraries in other cities to say, hey, what are you dealing with?
Yes, and we've been engaged in this for many years. And in fact, coming out of the pandemic, there was a national safety and security task force established that we were very involved in Hamilton Public Library. And I think what we found was because Hamilton, it kind of has had a history of being a bit of a gritty downtown. We had experienced sort of a lower level of problems back in the 2010s. So we had made a bunch of changes already that some other libraries were at this point in time looking to do coming out of COVID. So really, so absolutely. And then we've been talking to the libraries that have previously closed, an emergency closure, to see what were the circumstances and how did that work? What were the impacts? So we're going to keep that conversation going, and I do know that there's a lot of interest in the library community in solutions that work but don't create unnecessary barriers for people. And really what we're trying to do is keep the library open for everyone, but we just can't allow drug consumption or drug distribution in our space.
Do you think there's a level of harm or maybe even some irreparable harm that the library has suffered because of this activity?
I think, whenever, something like this happens where people become disengaged, it's going to take a while for us to get them back. And so I wouldn't say irreparable, except for maybe the young children. People are only 4 once. If there's a family's not coming to the library, there is a impact if that early childhood development is not being supported. And I think what people need to realize is that a lot of people that come in to use the library that live in the downtown area, they may maybe not have the resources to be, driving to Westdale or driving somewhere else. Right. So it's the people that maybe don't have a lot of choices we really need to focus on supporting them and making sure that any damage that's already happened, we're working to reverse that.
You mentioned the Children's Department of the Hamilton Public Library Central Branch is not living up to the hype or its former glory because of this activity. Have you noticed spikes at other branch locations?
No, not like this. Okay. And I think, it's
I'm talking about positive spikes. Like instead of going to the downtown branch, they're going to another branch.
And so I think the youth engagement is like the problem with youth engagement or family engagement really is more located at Central Library.
Right.
So we are seeing other libraries, have some great activities. And one of the things we found coming out of COVID is there is such a demand for in-person positive programs like story times. Right. We're doing some lectures now at the library. We have Friday concerts. And people are really embracing those. And so I think, there's a realization that we all need to be socially connected. And as a library, one of the biggest problems that we have in current society is really people's isolation. And Toronto Public Library says, Toronto's the loneliest city in Canada. It's a very rich city, but yet a lot of people, are living in an apartment by themselves, and they lack a lot of the community connections that maybe we've taken for granted in the past. And so we really need to nurture those community connections. So I think, like, for me as a librarian, I see the great thing about what libraries do is we bring in people of a lot of different backgrounds. And so when we talk about, we hear more about more racist things nowadays, and, there's a nastiness. Really, the solution to that is for people to see each other. And when, I think there's a pretty strong correlation between people's attitudes that are negative with lack of experience with the people they have negative attitudes about. The best ambassadors for newcomers is you get to know newcomers and you realize these are great people, and okay, we might have some differences, but those are actually things we can learn from and celebrate.
As a chief librarian, the isolation of an individual, the constant, glaring at their cell phone, that extra appendage that we all seem to have, the divisiveness of social media, does that worry you at night?
Well, it does, in the sense that I think that we're not having enough conversation. Yeah. And also what we're doing is, we're kind of jumping straight for, the talk about a proposal. Okay, we have this 2-month pilot, and then, I read articles and they're saying, we're denying entry to people, and I just like that. That's not true. I can understand why people might have concerns about anything new like this, but it's kind of like it becomes political, and it's not intended to be political. We're trying to do our job as a library, which is to be accessible to everyone, and also we have a special responsibility to help families grow the next generation of readers. And if we don't think, like, if we can't do that, Hamilton Public Library is not going to live up to its potential. And in a sense, it's the community members. We're here to help people decide for themselves how they can, contribute and have a meaningful life. And so, that kind of it's important that we engage, and especially we engage children early, and so they're learning how to read. Because what happens is if they get behind, reading becomes a stress point. And I think all of us know when there's something that makes us feel like we're not good at something, it's pretty easy to avoid it. Yeah. And so, like, this is the big strategy with how you make effective literacy is you got to have the kids having fun reading silly stuff, whatever they like. Because what it does is it equates reading with imagination and opportunity and inspiration. Yeah. And so then when they go into school, they're not afraid of opening up that book. They're curious. And it's that curiosity that, sparks many things.
CHCH News heard from some staff at the Hamilton Central Library branch who were fearful about, instead of, working with children or families in the library system, they were concerned about being, security people and making sure that the bad actors, if you were not getting into the library. Has that been addressed with staff?
Well, I think we're in the process of addressing that, and the way things are working. So we now have peer support workers from the community, from the Canadian Mental Health Association of Hamilton. We have our own in-house staff, CUPE members that are community connectors, that have a particular expertise at diffusing situations and knowing how to be empathetic to people who might be experiencing challenges. So we're putting sort of all our positive energy into making sure that that entry point is one of connection, not one of disconnection. And for the most part, it's working very well. I heard yesterday, I think there was one person couldn't come in because they didn't have a library card. And so we're tracking who is negatively impacted by this. The board has asked for this, and what is the reason? And so we're looking at that. So we need to make sure that as long as people are willing to be accountable for themselves, they're welcome in the library. Yeah. And it is kind of sad that we have to implement something like this. But to me, it'd be sadder if we just waited and allowed our children's department and our central library not to be the library that it could be.
Once the 2-month pilot is over, you're going to assess the situation, do some analytics, speak with stakeholders, including those who utilize the library. What do you think the ultimate plan looks like? What are some of the options that you think you'd consider?
So I think it's too early for us to say, but the concept is we're going to try this, and if it's successful, we would have this tool in the future, should it be necessary, to implement, as a temporary measure. I think, there's some concern, and people, well, what if you just displace the drug activity to another location? So we just want to be able to be in a position that we have a workable, low barrier solution that actually addresses the problem. Yeah. Fairly promptly, because I think one of the problems, and the police have been, there's been a lot of efforts this year on York Boulevard, or actually last year, and we've been there since 2020. I've been in that building since 2001, but since 2020, we've seen all this decline on York Boulevard, and kind of hoping for something to change, and we're finally seeing some signs of hope. There's, we have the TD Coliseum. Copley Building is getting renovated. There are signs that the downtown's coming back. And so we want to be there to be part of that and to help accelerate it, or at least, help give it energy in the right direction. Yeah. And if we're on a daily basis having people distribute and use drugs in the library, which frankly has been the case, not because we're not trying to do anything, but even the police, we work with police very cooperatively, and they if someone uses a library and causes a problem, they can't. If they were to arrest them, it would take a few hours and they'll be out. So I think there's some, and it's not for us to really, I guess, define what the criminal justice system should be. I think that's for other people. We just need to make sure that, anyone can come in the library and have a reasonable expectation that they're going to have a good experience, and it's going to be one of kind of opening their minds, not one of, oh my God, what's going on?
Mm-hmm. Once the pilot project is done, is there the potential that what is happening now kind of stays in place? Is that an option that's on the table?
Well, I think, and that's, as the plan works, we have the authority to do this until May 17th, a 2-month trial. Right. After that, we will need to have an approved protocol by the board in place before we were to re-implement it anywhere. So I think we have to see where the evaluation takes us. Early signs are this is very positive. We need to, make sure that we're understanding what's going on, and there's always unintended consequences of anything. So we need to make sure we do that. And then, and I don't think we would be going down this road if we didn't have reasonable confidence that it was certainly a better approach than closing. And, we've been asking for alternatives for years. And, we've tried all of them. And, and at the end of the day, we haven't succeeded in securing, a community space that all Hamiltonians can be proud of. And it's there, but it kind of gets hard to see when, there's so much just pain around, and so we need to be a force of rejuvenation, and it's hard to do that when there's this illegal activity overwhelming your place.
Yeah. Are there benchmarks or measures of success that this pilot project you'd like to see hit in terms of, more people attending the central branch, obviously fewer, drug users within the branch? Are those numbers in place, or an idea in place?
So they are, okay. And we haven't got the first, we're going to be doing it week by week, just assessing, and we'll look forward to reporting back on those. And you're right, so we're going to be looking at incidents, and specifically drug use in the library, calling emergency and naloxone administrations. So that's one piece of it. What is the impact on the problematic behavior? Then the other one is how is the engagement doing? How many people are signing up for library cards? How many people are in the library? All those things. And I think one of the things we see over the years is that probably the benefit side of more engagement is going to build over time. So I don't think anyone's expecting, 2 weeks from now we have a huge spike. Yeah. It's more of we need to be here. It's going to take time for people to get the word out or hear. Yeah, you know what? It's okay to come down. It's not going to be like what you experienced, in January, and so that will take time. But we're certainly seeing it, and that part of the reason why we started this week was because it's March break, and we have a lot of families and kids come in during March break, and it's we need to make sure that they have a good experience, and if we're not prioritizing the library for the next generation, I think I'm not sure what the future holds for us, really.
Last question for you. What is your message to residents who may have been at the Central Branch at one point, but have heard these stories or maybe have seen something that they didn't like and now they're reluctant to go back? What's your message to them? Well,
we'd love to come see you and see what's going on. And we're going to be reaching out to engage people on what we can do together better. And we'd like them to participate in that in that conversation. Most Fridays at noon, we have a free concert and some great and diverse talent from so many different genres. Come and for yourself and see what, come to a great activity at the library. And you'll see it's a great place. We had the Olympics on. CBC had supported libraries to show the Olympics. And so, we had, when we had the whole bunch of people watching the women's and men's hockey, and it was such a great time. So I think hey, we have the World Cup coming up, and I know last time we showed the World Soccer there's a lot of people that if you don't have the right cable subscription, you're not going to be able to watch the games, and then we have a lot of we had young women coming in. They don't go to bars, so there's really no option except to come to the library and watch the game. And, that kind of thing is such a positive activity. And I think one thing about Canada is we can, you have some people rooting for X team, another people rooting, but it's all in good spirit.
Yeah.
And it's like, because, in a sense, our community is made up of people from so many different places. And, certainly we've been doing a lot of work with our Indigenous neighbors, and there's so much, we have to learn from each other.
Yeah. Library is such a great resource. It's a place where, as you mentioned before, people come together to learn and share experiences and, brush up a resume or apply for a job or whatever the case is. Paul, thanks for the time today and explaining some of the things that you're going through with this pilot program and continued success with it.
Thank you. Appreciate the interest.
All right, that is Paul Takala, Chief Librarian at the Hamilton Public Library. Thank you for checking out the Newsmakers podcast. A big thanks to the all-star cast behind the scenes. If you liked today's episode, click the thumbs up, hit subscribe, leave a comment. You can catch the Newsmakers podcast on chch.com/podcasts and wherever you get your favorite podcasts.